Thank you very much, Mr. Farouk, and we can wait for the Q&A discussion. But before that, ladies and gentlemen, we are moving to the next speakers. We have Mr. Surahyo as a Project Associate of Digital Health UNDP Indonesia with the topic Bridging the Gaps of Telemedicine for the Future Health System. Okay, Mr. Surahyo, the screen is yours.
Okay, good afternoon, everyone. Thank you very much, Mbak Dini, for giving me time to share my experience in telemedicine. And also, I would like to thank also for the distinguished speakers in our previous speaker, Pak Irwan, Pak Ciprianus, Pak Setiaji, Pak Oscar, and Pak Farouk, who gave insightful information about the telemedicine, all the challenges and opportunities, and many other things. So I would like to share my presentation directly from my notebook. So please give me some time to do this. Okay. Can you see my slide clearly here, everyone? Yes. Yeah, thank you very much. Yes. Thank you very much. I was given the title of the Bridging the Gaps of Telemedicine for the Future Health System. So here, maybe I would like to give some presentation about the more narrower topics about what kind of the telemedicine is already implemented in Indonesia and what kind of gaps exist there, because there are so many type of telemedicine actually running now in Indonesia, from using the high technology and low end technology as well. So here, maybe afterward, we can see the bigger picture and or the complete map of the telemedicine ecosystem in Indonesia. Yeah. So before that, I would like to share you about the background of Indonesia as well. As you know, we are in archipelago countries. We have 17,000 islands, and unfortunately, the distribution of the hospital in Indonesia is unevenly, as you see in the slide. Most of them are in western area of Indonesia, so meaning that here we have still a lot of homeworks to improve health services in eastern and also central of Indonesia. So if we want to improve it by building or developing the physical facilities, maybe it takes time and also a lot of money should be used there. So meaning that maybe we would utilize the technology to help all our colleagues and the medical doctors there to give a better service by using technology which is called telemedicine, which is also in narrow meaning is for the teleconsultation here. As you see here, also in the next slide, you see that the distribution of our specialists as well also uneven. We can see that most of them are also in western of Indonesia, especially like pediatric, obstetric, and so on. Then all of the GP who works in primary healthcare in eastern and center of Indonesia, they need the expertise using the telemedicine by using the teleconsultation function. Even with very simple technology like maybe WhatsApp, and also we can use the higher technology using some kind of technology. So meaning that I would like to remind you just to refresh on the meaning and the definition of telemedicine itself. As you see, if we look at the telemedicine by WHO 2016, it simply says that delivery of healthcare services where patient and the provider are separated by distance. And it can use ICT or information and communication technology for the diagnosis and treatment of disease and injuries, research and evaluation, and also continuing education of health professionals. So you're talking about ICT itself, according to the ITU 2016, you could also use very simple technology using radio. I think I've witnessed it by myself, by people who lives in rural area, using the 2-meter radios to communicate each other, to give some expertise from another specialist, because there is no like 2G or 3G mobile communication. They just use the mobile radio communication using 2-meter radio, and it works well. So meaning that, yeah, we're talking about technology. So in Indonesia, there is a big gap from very low-end technology using radio, or maybe we can just internet using some high-speed technology using 4G connection and many other things. So then I would like to remind that telemedicine or teleconsultation or telehealth services in Indonesia, we still have a lot of gap or big gaps among them. So then I would like to share some data or experience that we have been working as a UNDP, and also we are very happy working with the Ministry of Health, especially with the DTO and the Pusdatin for the several years, and we really appreciate for the achievement that they have been doing until now, something like that. Yeah. Then here, if you see, if the telemedicine service in Indonesia, according to WHO as well, there are two kind of telemedicine. One is the provider to provider, and the second one is will be a client to provider telemedicine. So if we have been focusing more in government side, actually at the moment, the government or Ministry of Health already has the Temenin or Telemedicine Indonesia. Just recently, it just changed the name to be Comment. And also we have integrated a referral system or SysRouter. It works among the healthcare facilities. If also talking about private hospital, there are also many provider to private telemedicine as well, but I cannot mention here with so many. But if we're also talking about the client to provider telemedicine, the government itself already has a CLPDA. This is run by the Ministry of Health at the moment. Mobile VKN is run by the BPJS Kesehatan. And please do not forget, also during the pandemic, there are many new function extension from the hospital information system to serve the patient who cannot come to the hospital because of the COVID pandemic. They are already a registered patient who has already electronic medical record there. Then we also use this kind of telemedicine as well. Like just for example, one is called Tekon in Sarjito Hospital in Yogyakarta. Also there is an RSCM in Jakarta and many others. So there are also a lot of telemedicine services provided the hospital to the existing client or existing patient using some kind of technology, even just simple one like using WhatsApp technology, or maybe just give some new module or function on top of the hospital information system. And also, please do not forget that there are thousands of the primary healthcare also trying to serve all the patient using some technology because of the pandemic that they now to see each other physically or directly. Then they just use very simple one like using SMS short message services. Also, you can use the WhatsApp, some also Line, and many other things. This is also called the telemedicine. Again, we will see the gaps of the technology here. And of course, we also have our partner here, Atensi, providing a lot of telemedicine services with a lot of members there with high technology that can use for the teleconsultation using mobile application on the smartphone, using 4G communication and many other things. It's already sophisticated technology. Some of them already using artificial intelligence, bot chat, and many other things. So again, if we see on this slide, you can see the gaps among the telemedicine services in Indonesia. So please let me start with this telemedicine provided by the government, this Ministry of Health. It is owned and developed by the Ministry of Health Indonesia in 2017, but actually the Ministry of Health already started this project since 2012 using some technology for the simple one, the tele ECG and radiology, and they improved in 2014 with teleradiology as well, using some private sector. And in 2016, they also improved the integrated system using tele ECG, USC, and clone sources. But in 2017, they decided by themselves to develop and to build the Temenin or Telemedicine Indonesia. Now it became Comment, the name. And yeah, this is just why I present here just the example that the services already there and also supported by the government regulation, which is Ministry of Decree number 20 in year 2019. So it just show you the what is happening there in the telemedicine service among the healthcare facilities. Yeah, it's not from the healthcare to the patient directly. Yeah, and again, this is just shown a number of the use of the teleradiology, because actually they have only three basic functions: teleradiology, tele-ECG, and tele-USG. Also plus the teleconsultation. It can be used for many kind of services as well. We're trying to understand more, because maybe in the future, maybe UNDP can give some support also to improve and to give better services, especially to reach all the remote and rural area for the people who work in primary healthcare, especially in Eastern and Central of Indonesia. So here, the number of the teleradio use is quite high, because it's I think it's already did there. It show you the demand of there, but the ECG is still low. It's just like 200, 500, and so on. And even the USG is very low, meaning that if you're talking about the healthcare facilities to support, let's say, for the pregnant woman, for the babies, and so on, then we need to improve more. We have to support more how to use the television more efficiently using this kind of technology as well, right? And this is also the this audit I borrowed from the Minister of Health, from the Director of uh, from the health services, yeah. And if they show you that actually demand already there, the utilization is already there, but maybe in the future there needs some improvement to have more, or to get more GP on the primary healthcare to be supported by the specialists in a district hospital as well, something like that, yeah. And it's just showing you the area that they are already very active using the telemedicine, which is Temenin or Comment right now, the Parapat Hospital in the Sumatra, in Supyori in Papua, Tonjong and Karanganyar in Central Java, and many other things. So when I show you the specialist doctor who serve a lot in telemedicine, they are very active. Also, maybe there is some motivation why they are very active to support all the consultation from the rural or remote health services, like the primary healthcare, right? It's from Andamali Hospital, from BIA, and many other things. If you see all the district or city, it gives us a picture that this telemedicine is already there. It's running also well. We cannot running well, but it works good. It helps them, especially the GP in the primary healthcare, to have the expertise from the specialist. So then, yeah, we need to explore more to support the more to get better reach to more rural area or remote area that need to be supported by telemedicine services, something like that. So you see it's not already in North Sumatra and Papua, and Lampung and Sumatra as well, Riau, Maluku, East Kalimantan, Jambi, and many other places. So here is one of the example run by the government, which is Minister of Health, in area of telemedicine for the healthcare facilities, among the health facilities. So this is also some pictures showing that challenges in rural and remote and rural area in Indonesia. As you see, we also need more about the medical device to be integrated to the telemedicine services. Either is for Temenin, maybe or for mobile JKN, or many other things, maybe also in attention group who are trying to reach the remote and rural area. There are also still some challenge how to integrate with the medical device, like here in tele-ECG, or we can use some CR, computed radiology. It is a cheaper solution to scan the high resolution X-ray film, yeah, rather than we have used a digital X-ray is very expensive. And we also see the challenges about the internet connection, because again, even the Bhakti with the Palapring already expand on the backbone of the fiber optic to everywhere in Indonesia, but still in that area we need more access using a lot of BTS provided by telecommunication provider to give better connection or communication. Again, this is also still of challenge or homework for us to improve all the ICT or telecommunication services if we want to use the technology to support the medical doctor or the nurse, or maybe in remote area, using some kind of network technology to conduct the teleconsultation service like here. There's some picture like in South Sapor in West Papua. It's very remote area. We have to take like 5 hours from Sorong. In Tionggohang, Makam Ulu, we have to take 7 hours from Samarinda. Then by boat on the Mahakam River, we have to travel like 8 hours by boat to reach the Tionggohang in Mahakam. There's so many infrastructure challenge as well, and in Indonesia. And then we have to get more support from the telecommunication provider to expand their reach. So here, as you see, actually Kominfo and Bakti is very seriously developing their project Palaparing to reach all the areas in Indonesia, giving the backbone area using fiber optic. But still in this area, we need to get more about the like BTS, the provider, the tower to reach all the people there. There are also many actually what's that alternative solution like using VSAT or the satellite, but again, a satellite is very expensive and also very low and a big deal of that. If you see here and in UNDP as us, we have been working also with Atensi to conduct some assessment. We did it in 2020 and 2021. We did this final assessment telemedicine service in pandemic situation in Indonesia, and the report is already finalized in 1st of March 2020. I will give you some result afterward. And also, of course, just recently, UNDP also is supporting the Ministry of Health to develop the digital health transformation blueprint, and it was launched in 16th of December. And we still are working from the roadmap and strategic direction, and many other things will come in the future to support the digital health transformation in Indonesia. So as you see here, based on the assessment with Atensi last year, we see that the result like here, the most accessible telemedicine service was the teleconsultation. The second one was the health article. And the third one will be online appointment, many other things. And also, again, we're talking about the remote and rural area. At the moment, still, the region with the highest telemedicine user for the Atensi group still in Western area, like especially in DKI Jakarta, in Java, East Java, Central Java, and we are dealing some of them already also in Sumatra, Bali, and Manila. So we still have homework, still have many things to do to reach in remote and rural area. And also, interestingly, the user demography by gender mostly are from women. Maybe it is also like a tradition in Indonesia. If talking about the health, mental health issues, usually will be handled by the mother or maybe someone who will take care in the family. And of course, also the user of education, because this is like more in running in smartphone application. Then the user education background mostly in from people who are graduated from bachelor S1, and some of them are senior high school. So we still have some area that in talking about the digital literacy, especially in rural and remote area, or we can improve people who are, let's say, only have education elementary and junior high school to use the technology appropriately, especially to get the digital health services, something like that. And as you see here, based on this our assessment, it says that the
Father Surahyo, you have 3 minutes left to present.
Good. Okay, yes, I think almost finished. Lack of regulation, I think we did it all in our previous webinar as well. The human resource as well, again about the infrastructure, and also we need strong support from the government, from the regulation. We also did also in the previous webinar. The readiness, we need to conduct some survey on that, and the payment model, we also conducted in the previous webinar with BPJS Kesehatan about how we can do financing for the telemedicine service. Yeah, the Minister of Health just recently with UNDP as a supporter, we launched the strategy transformasi digital kesehatan in 16th of December. And I think Oscar already also explained that they have priority as well in telemedicine, and Group C saying that expansion of telemedicine technology. So then they have a high priority in improving the telemedicine services in Indonesia. Also, I borrow from the AMO. This is a partner of the JICA. They also already conducted a study recently to map all the telemedicine services or telemedicine ecosystem in Indonesia. We divided into three groups. One is from public with Minister of Health, public from the BPJS Kesehatan, and the other is from the local head company. As you see, there are some group like from user, from general public, from patient, puskesmas, or primary healthcare, and public hospital. It says some remarks saying that CRPDI is still limited exposure by public, long response time. Feminine is also limited functionality, slow integration with the medical device. This is also another issue that we should cover. And the referral information system, mobile JKN has wider outreach and more users than CRPD and Feminine. It has been used in primary healthcare, especially for the GP to serve the patient who lives in rural area using mobile JKN in the user and using mobile JKN Vaskes in the primary healthcare. It also Peduli Lindungi, this is most active user, it's like 70 million or maybe more now. I think mostly in 90 million user. And on the private medicine, private telemedicine, it also has remarks about network infrastructure and logistic barrier, less incentive to cover the rural and remote area since BPJS do not cover the fee for private telemedicine services. And there are still few users in rural and remote area because it's not been socialized anymore in maybe urban and big city and many other things. The last one is also saying that, yes, actually, there are many kind of telemedicine in Indonesia. If we refer to the WHO, as you see, they will be divided into mobile health, wearable sensor device, data science, and so on. It also in a group of client, patient, healthcare provider. Yes, we have some, but we need more. Here in the last slide saying that things to do. I think the message is, firstly, we have to conduct the complete mapping for all telemedicine services in Indonesia. Then we also must provide the strategic framework. We should have the ethical and ethical practice in providing telemedicine service. Government support toward the general or operating guideline of the services. Coordination among the national institution or state authorities, and also with the private sector, especially like fancy international provider in regulating the guideline for telemedicine practices. The last one, we also need the public perception resources toward telemedicine based on research finding or community survey. We haven't done yet. This is our homework, what we did with Atensi last year, and how the stratification level after using the telemedicine. I think that's all, Mbak Dini, from my presentation. Back to you. Thank you very much.
Okay, thank you very much, Mr. Surahyo, for your presentation. So, ladies and gentlemen, we are moved to the next agenda, Q&A discussion. So, if you have any question in your mind, please feel free to text on the chat box. Jadi kalau misalnya Bapak dan Ibu sekalian ada pertanyaan, silahkan diketikkan dalam kolom chat box dan jangan lupa sertakan dari mana berasal dan juga ditujukan kepada siapa. Dan satu lagi pengingat dari saya, kami menyediakan untuk fitur interpretation. Jadi kalau Bapak dan Ibu agak kesulitan untuk memahami, kami menyediakan dua bahasa Inggris dan juga bahasa Indonesia. You can click the globe button on the right bottom on your Zoom screen, so it will help you to memahami diskusinya seperti apa ya. Boleh kalau begitu kita lanjut kepada sesi discussion. Maksud saya. We have Bapak Daniel Oscar Baskoro, Mr. Daniel, Mr. Farouk, and also Mr. Surahyo. Okay, so we have the three musketeer here, Mr. Farouk, Mr. Daniel, and also Mr. Rahyo. We have several questions from the participant here. So maybe the first question, it's come from Mr. Didit from University of Brawijaya. This question is supposed to be to Mr. Daniel. Mr. Didit, as Mr. Daniel, during the implementation of Integrated Health Services Platform to be expanded and accessed nationwide, what is the national regulation concern to the privacy data? It relates to data which rely to international or regional regulation. Maybe this is the first question. Mr. Daniel, can you answer the question directly?
Yes, thank you, moderator, for the question, and also Mr. Didi for the question. For the question about the talking about the data privacy related to the telemedicine. So I want to answer about this basic concept that the currently the global regulation, the policy about the telemedicine is we are all countries I think are referring to the GDPR regulation.
Okay.
The GDPR regulation is a baseline for the how we protecting the data, including the personal data. And from that baseline, from the GDPR and also other regulation also related to data privacy and also data protection. So this is the regulation should be the baseline for the many startups and many products related to telemedicine. So that's the basic concept. So when we develop the project related to medicine, they need to comply with that regulation, the GDPR, for example, or also other policy also. So there are some standard on that. But Indonesia, we are currently don't have any specific regulation related to personal data protection. The regulation there, but still in the development.
Okay.
And still development, not specifically for the health, but for the general purpose for the data protection. And once it's done, once it's done, the regulation, we will referring to that regulation. That's the future goal, But while the regulation not yet done, not yet there, please refer to many regulation and policy related to data protection, especially for GDPR. The basic concept is about the consent, for example. If you need to use the data for many purposes, please make sure you have the consent on that, so people can understand how the provider, how the system or the startup use their data. That's the basic concept for the practical use there. And also related to that, the upcoming regulation for the telemedicine for public, we are also will address on that issue also. So we're not yet defining any specific terms related to data privacy in our concept, and we will consider on that. But basically, we will refer to the main regulation on the data protection from the national government, and then we'll going drop down in the specific regulation of telemedicine, and that will be related with its other regulation. So hopefully that's answered the question. So the basic things, the two aspects. First, we not yet have the regulation related to the data privacy, and please refer to the global standard on the data privacy, and make sure you refer on it. The first thing. So don't forget to refer. And then the second thing, in the practical implementation, don't forget always put it the consent in any collection of the personal information, in any feature and the services. If you are having the services related to collecting data, especially for the telemedicine, I think there's a lot of data collection on the personal. Okay. I'll refer back to moderator. Thank you.
Okay, Mr. Daniel, thank you very much. So I think if I'm not mistaken, regulation is already exists, but it's still underdeveloped, like Mr. Daniel said. Okay, maybe the second one is I just want to know, Mr. Farouk, your opinion based on your presentation or based on your experiences about the privacy, about the data privacy. Is there any comment from the privacy data in telemedicine from your country, by the way?
Well, if you would want to, I think the regulatory environment is by the countries.
Data privacy.
And that does include data confidentiality and management. But it's not only in terms of, because sometimes again the terminology becomes too simplified in terms of confidentiality. the issue with data confidentiality is not only in terms of ensuring the secrecy of the data or of the persons, but also ensuring how the data is being used and how the data is being entered into interoperable system of digital health. So the regulation is not about data confidentiality, but regulation is also about the digital technology, the use of the digital platform, digital environment. Okay. And that's where I think that while Papa Daniel were mentioning about the existing regulations do talk about these confidentiality issues, but the existing platforms are still deficient in terms of ensuring that the digital platforms are devoid of any potential of loss of data or leak of data, and that would be meaning for patient health records, for transferring of records, for even for surveillance purposes, and even for using those to count in overall health system surveillance. Well, your question was about my specific country, because I'm probably representing on behalf of the organization, or so I didn't.
Based on your experiences, okay.
Yeah. Mm-hmm. And that is why most of the countries right now are at the stage where they are trying to ensure that this element is one of the major component in any digital health transformation regulatory environment.
Okay.
Yeah.
Okay, Mr. Farouk, I believe that you say about the benefit of digital health. You have improving access and then increasing financial efficiency, supporting and expanding coverage for UHC. I believe that every country has their own uniqueness, has their own way to face the disruptive era and also the digital economy changes. So if I'm not mistaken, you mentioned the fourth benefit of digital health. How we can gain the benefit of digital health, this fourth of benefit? I mean, like your opinion about this. How Indonesia can learn about to raise and to gain the benefit of digital health. Maybe you can give your own opinion to this, please, Mr. Farouk, before I move to Mr. Surahyo to answer another question. So, Mr. Farouk, please, the time is yours.
So I can quickly answer this in the shortest possible way. If you realize overall, when we look at the global health architecture or health system architecture, that also has a lot of differentials across the countries.
Yes, indeed.
But then, what does it mean to the digital technology? If a country that is well advanced in use of digital technology compared to the country that might just have a few telemedicine services, let's say mobile services, simple mobile services, or their penetration of internet is not really good, then where should they go? That is why what WHO has done is developed a global strategy on digital health. And that strategy is not talking about very specific specificities of interventions, but what it is talking about is specific of the strategies that the countries should adopt according to their existing technological status or existing economic status. And then they define the interventions and the mechanisms. For example, I think one of the interesting examples is from India. It's a huge country. It's a low middle income country, but then while there might be internet users and mobile penetration, the idea of reach out was more important to the government than idea of the type of technology. So what does it mean? That when they initiated an M cessation program, mobile cessation, that is for tobacco cessation, and they didn't create an app. What they created was a platform of SMS messaging. That was an automated system that registered users, and then the users were able to automatically receive on weekly basis the instructions or messages. So what I mean to say is that according to the country situation, according to the target audience, their affordability and their knowledge of the health literacy, the targeted approach has to cater all these elements. So you don't need to tell a vulnerable individual that you need to have a smartphone to avail the technology that is available, but you have to create the minimum possible way where you are able to reach out according to his or her affordability and availability. So that's where the flexibilities should be there, and that's where the global strategy on digital health talks about those flexibilities.
Okay, thank you very much, Mr. Farooq. So every country has their specific strategy, and then also probably have a different mechanism to face the digital telemedicine improvement. Okay, we are moved to the next question. It's come from Dr. Santi. I think I'm gonna ask to Mr. Surahyo. Because the procurement of telemedicine platform is very expensive and complex, can the doctor join the Cares Protect network in one platform, which is a virtual clinic that managed by the doctors themselves? Maybe Mr. Surahyo, you can answer the question directly.
Yeah, I think it will be possible. I mean, nowadays it's talking about the cloud technology, but the platform is already there, and maybe the medical doctor can just utilize, become a member of that kind of services, and then yes, I think it's really very possible to do that. The technology will allow to conduct it. I think member of the agency also will very helpful to help them
Will be able to
provide
join.
that. Yes. Even also in some hospital who has some already good telemedicine services also is able to solve the problem, I think.
Okay. Okay, Mr. Surahyo, I have a question in mind. So based on your presentation, you say the data about the highest number of consultation is coming from Simalungun, from North Sumatra. Is there any opinion, your opinion based on this data, Mr. Surahyo? Because this is very curious about the highest number of consultation. It comes from North Sumatra, from Simalungun. Okay,
Yeah.
Mr. Surahyo.
I think it's based on my experience as well. Not before that, related to the data from the Ministry of Health, because sometimes I would discuss with them from the General of Health Services. It was from the Orangsbari in Papua. So meaning that usually the why the highest number of telemedicine service is from that kind of area is because of the doctor itself is very active.
Okay.
It's very helpful. He or she likes to participate more in the telemedicine. It's usually, based on my experience, based on the person who runs or to serve the telemedicine service there. It is based on it because the previous data was from the Orangsbari in Papua Barat in West Papua.
Okay, thank you very much, Mr. Surya. It's very interesting. Women are still the highest number of the consultant number. Okay, I already asked Mr. Farooq for 2 questions and Mr. Surahyo for 2 questions, and I'm going back to Mr. Daniel. So, Mr. Daniel is, I have a question still from Mr. Didit from Universitas of Brawijaya. The second question is, what kind of privacy data cannot be exchanged or stored through the cross system with telemedicine use, with the server store in national or foreign country?
Okay, so yeah, the basic information about the data storing, related to health information, we can refer about the health medical record. So that's the basic concept of the data storing and also data management on the health medical record. So in the current situation, we will launch in the next following weeks, the regulation about the electronic medical record. So we will have the guideline and the policy or related to electronic medical record. We already have the final discussion and also final draft. and will be launched soon on that regulation. And the basic information about data sharing is also data storing. Yeah, is related to the summary of the patient data. So the data sharing is not all about the data about the record of the patient, but the summary of the patient that can be shared to other entities. That's the first thing. And the second thing about the host where's the location. We want to put the digital transformation, yeah, that we already explained is related to the platform as a services. So we inspired by the UK government how they make the digital transformation health. So they put the platform as a service as a key. Why? Because if you put government as a final destination of data, yeah. So as a final data location, it's not possible for the health especially. Because why? Because that health data is very big. From the medical record, yeah, we can see the data based on the number, based on the text, but also there's a data on the X-ray, on the imaging format. That's why if we store all the data in the central government, that's not possible. We need to have a very, very big infrastructure to support that. And that's why we built a platform as a service. So we not store all the data, but we have the bridge, we have the API to connect the system, to connect the platform with its health facility. So its health facility own their data. But if we need the data, for example, for the policy making, for example, for travel purpose, for example, and also an important thing about the crisis situation. So we need to prepare the future pandemic, right? In the future pandemic, that we can learn, yeah, from the previous pandemic. We cannot get the data. We don't have the data. We have a very complicated process because we don't have the how we can collect the data. So we built this platform. So anytime we have the critical situation, we can call the data. We're not collecting data every day, but we can call the data every time if we need for the critical situation, for example. So just to answer that, I want to answer about the question. Yeah, the first thing, the policy about the electronic medical record will be launched soon, and the data sharing specifically will be focusing on the resum of the health medical record, not all the data, the open data sharing. The second thing about our approach to integrate the data by using the platform as a service. So not collecting all the data, but we are creating the bridge. We are creating the API to call the data anytime we need, anytime we use, especially for critical situation. I think that's all from me. Thank you.
It's probably the last question for Mr. Daniel. It's come from Dr. Nico. After pandemic, what next for the telemedicine project, Pak Daniel? Are there any plans already? How did the
Sure.
government platforms, stakeholders, and private?
Yes, sure. That's very interesting about telemedicine. So what we learned, yeah, from the pandemic, we're building the policy for the telemedicine for the stabilization patient just only 1 week. This is the good example, yeah, about the policy making. Actually, in the usually, yeah, in Indonesia we call it the power of kepepet of deadline power, right? Yeah,
Okay.
because health aspect is both life, right? So we cannot wait like for a long time to develop a policy that related to health, related to life of the people, right? So in this year, we want to expand the policy that already used right now. Yeah, I think thank you so much for your attention to support, yeah, on this implementation of the policy, so we can make this happen. Policy, not only policy, but also the good benefit for the citizen, our citizen. And we want to expand this not only for the pandemic, for the COVID-19, but we will expand to many other diseases to telemedicine. Pak Surahyo already explained that we already have the regulation related to the health facility to health facility telemedicine, but that's not enough, right? The request, the needs of the user is about the telemedicine to public directly, and we want to develop on that. And the second things, we will develop the policy. But the second thing, important thing also about integrating that into the ecosystem of the industry, right? So we want to enhance, we want to expand the number of the telemedicine staff. Currently, that's supporting the telemedicine for the COVID-19 is just only 17. And hopefully, if anyone wants to create the startup, create the industry for the telemedicine, please do it. We want this because this is very important. We have 270 million people, and also we have 50,000 islands. If only 17, that's not enough. So we encourage all people, all startup or industrial to build the telemedicine and help us to put the telemedicine as a key services for the health sector as a primary. So our goal is also to put the telemedicine as a primary. So we want to make sure people not only thinking about, oh yeah, if I got sick, I come to hospital or come to puskesmas, but we want to change the mindset. If I got a sick, okay, I use the app to call telemedicine. So that's the second thing. We want to change the mindset of our citizen to use the telemedicine as a primary tools for the services. And the last one, this is also an important thing. We are on discussion to make sure the financial aspect of the telemedicine is also covered, right? This is important thing. Okay. Because the telemedicine is only about the service, but also how we can make sure the telemedicine is covered by insurance. This is very difficult, but we need a lot of support from the ecosystem together to push on this. For example, I just come to the conference in the Orlando last 2 days, earlier in New York right now. In Orlando, we hear the good practice from the US government. They put the insurance for they integrate the insurance from the government to the telemedicine, but they start in the rural area. So any telemedicine that used in the rural area, that's covered by the government. So just extend, also enhance the level of the quality level of the telemedicine. So the rural area want to use telemedicine because it's free. So the U.S. government starting on that. So just a good example from the U.S. U.S. about integrating the government insurance to the telemedicine starting the rural area. And we are thinking on that also, but this will be a long process for the insurance. But we need the support from the ecosystem and also the communities to push that because that's important. So the aspect in the future of the telemedicine.
Okay.
Yeah, I will back. Thank you.
Thank you very much, Mr. Daniel. Actually, I have one question before move to the session 2, to the second session, to Mr. Farouk. Actually, I have one nice conclusion from Dr. Santi. That's all about, in telemedicine ecosystem. So we have 4, the first is government, four actor, like the government, and then the third party to keep the data collection, and also the doctor or the hospital, and the fourth one is for the user or patient. Okay, maybe you have your own opinion, Mr. Farouk. Is that you agree with this conclusion from Dr. Santi? If we want to build the great ecosystem.
I think I did give this answer. If you see any of the health system, the private service providers and the government service providers are always there. So you will not be able to distinguish, or at least to say that the telemedicine or any system has to only to be owned by the government. Unfortunately, that doesn't happen anywhere in the world. Now, but what is important is 2 things, and that's what I alluded. One is the regulatory environment on the digital system itself. That includes the data management, that includes all the regulatory principles that any private or public healthcare provider. But the second thing is important, and that is the public health science. I think the whole gist of my presentation that I focused on was whatever we are trying to give services through, whether through a private system, whether through a public system. Yes, there is a government that should be a regulator. There is a patient or a end user that would be there, having a possibility to avail any of these mechanisms. But then the principles and the standards should be maintained. And that is where the second role is, that in terms of public health science, the type of service provision, the quality of service provision, the uniformity of service provision, and the quality standards are where those protocols and mechanisms and regulatory systems are needed, in addition to the digital health regulatory systems.
Okay, thank you very much, Mr. Farouk. So I want to thank to Mr. Farouk and also Mr. Surahyo and Mr. Daniel Baskoro. Thank you for your time. We are going to move to the second session. So for all speakers, if you are available, please stand by until session 2 to the second session in the Q&A section, because we will begin to the panel discussion for now. Okay, thank you very much once again. And ladies and gentlemen, we are moving to the next session.